Okay, all right. We're back here on the Lynn Hayes Freeland Show. I'll tell you what, one of the best things about this show is the stuff that I learn. And I like to think if I learn stuff on this show, you do too. So I'm glad you tuned in. We're actually talking about eating disorders. And let me just clarify here, because we've talked about eating disorders. And I think a lot of times when we say eating disorders, people automatically think about anorexia, because that was like a very popular term, medical term that people heard about. And so when we talk about women of color, though, we can be anorexic as well, correct?
Mm-hmm.
We just don't see it as often.
Right. Right. Yeah, typically, at least the studies that I've read has shown, we tend to be more on the bulimic, the eat and purge, or the binge, or the binge side. And again, because of, and Dr. Timma can speak to this more probably, is the issue of the body image. And I think we touched upon this a little bit, excuse me, where 40 is the new 20 and 50 is the new 30, and trying to fit those models and those molds and trying to maintain some semblance of whatever youth meant. There's that aspect of it as well. But then in our culture, it's also, I can do everything. We've touched upon that.
Right.
I can do it all. I can do everything. And feeling like I can do this, so therefore I can manage this. And you're not managing it so well.
And you're not managing it. And so then, let me come back around. So that idea that I can manage this, and I'm not really managing it, that's probably the first clue that I need to talk to somebody.
Yes, yes. And again, culturally, you know, we have a stigma around talking to someone, you know, whether it's PCP or whether it's a mental health professional, but just recognizing that there is a problem and then kind of getting comfortable enough to say to someone, you know, PCP or mental health professional, I'm having an issue in this area, help me. You know, I don't know what to do. I don't know what other coping skills to use. I don't know how to process this or unpack this. What else can I do? I think is one of the first, you know, one of the first steps to kind of getting that help. I think recognizing is the first step in getting help in a lot of different areas.
And have we made progress in that area? Because let's be realistic, there was a time that we as African Americans didn't ever think about talking to a therapist or a counselor. It was just something you didn't do. But I do feel like if nothing else, reality TV has made it a little bit more acceptable to go and talk to somebody if you need to.
Yes, I would say when I think about my practice and the people that I work with and interact with, yes. I think that it's becoming more and more prevalent when you see someone that looks like you, that's you know, in the that helping profession. It makes you a little bit more comfortable. You're like, okay, maybe I can open up to this person. Maybe I can explore some things that have generationally been an issue. So I'm seeing it more and more.
More and more. You know, and I think a lot of that too applies to your PCP. I mean, the realities are, if you can't be honest with anybody else, you need to be able to be honest with your primary care physician.
And I think a lot of that is built over time. If you have a patient, or if you're a patient, and it takes a while to find the right doctor or nurse practitioner that fits your needs, that you feel like you can disclose things, because certainly you want to always feel as though there is room for you to express yourself to this individual. And if you feel like you might have been cut short, or if there was something else that you didn't get a chance to say, and you feel like, well, I don't know if I'm going to be able to get this out, you're welcome to find the person that you need. I think on the end of healthcare, what we can do better is to leave things open-ended, allow people time to express themselves. It doesn't take much effort to say, is there anything else that's going on that you want to talk about? I don't want you to, I say this a lot, I don't want you to leave here feeling like you were not heard. And so sometimes that's all it takes to kind of get that piece of information. And you know, unfortunately, time is always of the essence, and if there is something painful that might have been disclosed and that encounter might be nearing to a close, say, you know what, I'm going to make sure that I make another follow-up so we can discuss this further, or say, you know what, these are some resources that we can discuss this further. But briefly, what I wanted to talk about was just if there isn't someone in the healthcare field that can assist you, certainly if you are concerned about a loved one or concerned about a coworker, coming from a place of concern, I don't think anybody's ever going to get offended. That might just be the nudge that they need to say, you know what, there's an issue. And there are certain signs that you can see in an individual that may have a potential eating disorder. If you're dining with them and they're not really eating their food and they're just moving the food around, if they excuse themselves briefly after a meal, if they consistently are cold. Those are just a few signs, not that many, to say, you know what, maybe there is something going on that I can just at some point in a safe space say, you know what, is there anything that you want to tell me? And just coming from a place of non-judgment, because there's already shame associated with this.
And I'm just curious, when you say they're always cold, what does that indicate?
It may indicate that there's issues with their endocrine system. Their thyroid hormone might be affected by malnutrition. They may have a low body weight count, and so or a body weight, and so they're always cold in that regard. Anorexia and bulimia can affect every part of the system, from a cardiac standpoint, a GI standpoint, endocrine standpoint, even can lead to accelerated osteoporosis. So it's a full body disease, and it's important because it's one of the mental health disorders that has the highest mortality rate.
Wow. Okay. Awesome. Now, you're still doing research. You still want to hear from folks.
Yes, I do.
How can they reach out to you?
They have information on my website.
On your website?
At Point Park.
Okay.
At
All
Point
right.
Park, EDU.
Okay. And
And-
I think we have that information. We'll
Right.
show that at the bottom of the
And
screen.
they can connect with me through there.
And let me see, we probably have what? I'm guessing we have like about 1.5 minutes, 2 minutes left. So very quickly, 30 seconds, what would you say to people? This is the holidays. So people are going to be dealing with all this stuff that we brought up. What would you say, 30 seconds?
Be mindful. Be mindful of your reaction, your emotions, how you're reacting to things, and be thoughtful about what you're consuming. Yeah. And dealing with others, your relationships, because all of those things connect the dot in terms of your mental health, emotional health, physical health. Be aware.
Be aware.
In the mirror.
Forgive yourself. Really, just forgive yourself, because this time of year there's grief that's being processed. There's economic strain that's being processed, and unfortunately, this is my philosophy. I think sometimes as a society we put too much stress on people being happy, but not necessarily being honest.
You know, interesting. You get the last word.
I would say identify at least one supportive person. You know, college students are coming home for the holidays. People are taking additional time off from work. Find one person that you know you could confide in, that you can talk to, that you can just maybe even just sit in silence with, but you know their heart and you know that they're supportive. I think that means the world, and it also can open up, you know, those conversations.
Those conversations,
naturally.
indeed. Ladies, thanks so much for joining us. We'll be back in 1 second and wrap all this up and tell you about next week's show, so don't go away.